Hi, I'm Lisa Costabere and we're here at the 8th Annual NIM Symposium 2023 Melbourne. I'm here with Paul Taylor. Thanks for joining us, Paul.
Pleasure.
Now, you're a neuroscientist, a exercise physiologist, and you're studying to be a psychologist too.
Correct.
Wow. Tell us what you presented on today.
I presented on exercise as medicine.
Wow, interesting. Tell me more about your presentation.
Well, basically, I started with the premise that we have a hunter-gatherer's genome in the modern world, and we're really built to move, and we're not moving very much at all. And it's been shown that exercise can prevent and or treat 26 of the most common chronic diseases, right? And we also now understand the ingredients of exercise. There are these things called myokines that are released from your muscle and actually have a positive impact on every organ and every organ system in your body, including your brain. So it reduces your risk of heart attack, of all-cause mortality, improves mental health. There's almost nothing that exercise doesn't help with in terms of physical and mental illnesses and ailments.
Now, are there any specific types of exercise we need to be doing and for how long, dose, duration?
Yeah, so look, that's a big question. So for me, I like to go 3 hours per week. So the guidelines are 150 to 300 minutes. So I like 3 hours and do 1 hour of cardiovascular. About half of that would be what we call steady state, where you can still hold a conversation. That's really good for what's called your mitochondria, the batteries of your cells. And then another half hour of high intensity interval training where you go hard, back off, go hard. Then the next hour, you do full body resistance training. So 2 to 3 of those full body sessions a week, 20 to 30 minutes. And it actually becomes more important as we become older, not less important, because we have to preserve that muscle so that we can stay functional in old age. So I always say, as you get older, you have to lift heavy shit. There's just no way around it, right? And then the third hour, I say, it can be either cardiovascular or strength, but you've got to use your brain. So you've got to be thinking while you're moving. So this could be dancing, it could be doing yoga, but it could also be doing boxing or weight training where you've got to really think, or if you like to cycle, mountain biking where you really have to look at stuff. If you like to run, running on trails where you have to look at every footstep, because then you get whole brain activation when you do that. And then the really important thing is doing little bursts of what I call movement snacks. So 30 seconds to 2 minutes of vigorous activity spaced throughout the day actually can reduce all-cause mortality by about 40%. This is in non-exercisers, and so that is huge. So it's just about all of these little opportunities to move, and both your body and your brain will thank you for it.
Wow. What exercise do you do?
I do a bit of cardiovascular stuff. I do a bit of boxing. I do resistance training most days as well. A little bit of running and a little bit of cycling.
Oh
so
my God.
I kind of mix it up.
That's a lot.
It is.
Now, for our audience that don't get to see your presentation, what are the key points you want them to take away?
Well, really the key points is that we are a hunter-gatherer's brain in a modern world. And the current human genome requires and expects us to be highly physically active for normal functioning. So for me, if you want to live your best life, exercise is an absolute foundation of it. And probably the biggest message is try to find something that you enjoy. You know, go and do a team sport or dancing or something like that. You've got to find something that you actually find enjoyable, and also be clear about why you're doing it. You know, think about how you feel afterwards, not, oh, I don't want to get disease 30 years down the track. Thinking about how you feel and how much better you function when you've exercised. And a big thing for me, do it in the morning, because that shit gets done.
Yeah, I agree.
All have those days, right, where I'm going to exercise after work and then life gets in the way.
Yeah, definitely. That's a really good tip, everyone.
Indeed.
Now, where can our viewers find you? Where can we find more about you?
So the best places would be my podcast, which is the Paul Taylor Podcast, and my website, which is paultaylor.biz.
Fantastic. Thank you for joining me today.
Pleasure.
Thanks everyone for joining us. Don't forget to check our socials and visit our website for all our infographics, articles and podcasts. I'm Lisa Costa-Beer. We'll see you next time.